Hello, my name is Dr. Jonathan Hall. I'm a consultant gastroenterologist and endoscopist at Imperial College Healthcare NHS Trust. As many of you will know, some procedures have been delayed and postponed due to the COVID pandemic, but I'm pleased to say all hospitals have now resumed their endoscopy service, both for colonoscopy and gastroscopy. If you have been scheduled for one of these procedures, it is really important that you attend so that your symptoms can be investigated and a decision made if you need any treatment. The risk of missing an important diagnosis is much higher than the risk from COVID, as the situation has changed substantially in the past few months. We've learnt a lot about COVID and how to prevent spread in hospitals. All hospitals have taken serious measures to create a very safe environment to reduce your risk of COVID. I hope this video will help you understand what to expect when you attend for your endoscopy and what we are doing to make your attendance as safe and comfortable as possible. Specific advice about testing for COVID and self-isolating in advance of your procedure will be given by your hospital. Testing is to ensure you are not infected, and self-isolating will help protect you before your procedure. This advice may vary slightly depending on the procedure you are having and also the hospital you are attending. Therefore, this video is intended as a general guide only. It is unlikely you will be able to be accompanied beyond the entrance to the hospital unless there is an exceptional individual need. If you think this applies to you, please discuss this with your hospital as soon as possible in advance of your appointment, as anyone who does need to come with you will also need to attend COVID testing. Your hospital will inform you in advance of how to enter the hospital for your procedure and what to expect on the day. This is likely to include temperature checks, using alcohol hand gel at different times during the day, and wearing a face mask, which will be provided for you. You will be directed to reception, where the receptionist will check your details and attendance. Please do not come to the hospital if you have a new continuous cough, a high temperature, or a loss of or change in your normal sense of taste or smell. If you are unable to attend because you have any of these symptoms, please contact your hospital as soon as possible to let them know at the number given on your appointment letter. One of the endoscopy nurses will come to reception and take you to the admission room, where they will take your blood pressure and answer any questions you may have. You'll be asked to wait in the admission room to help maintain social distancing with other patients. The endoscopy team will then come to the admission room to say hello and to go through your pre-procedure checks. The team will then go to put on their personal protective equipment, better known as PPE, which can vary depending on the procedure being performed and the particular member of staff. So do not be surprised if you see staff wearing different types of PPE. One of the endoscopy team will come to escort you to the procedure room. Once you have had your endoscopy, you'll have some rest in the recovery area. The endoscopy team will discuss the results of the test with you. When you are ready to leave, a staff member will contact the person collecting you to ask them to come to the designated meeting area. They should not enter the hospital. One of the nursing team may take you to the person who has come to collect you. If you have any questions about your procedure, including any risks due to COVID, please ask the team in your hospital and they will be able to answer these. I hope this video helps to reassure you that it is safe to go to hospital for an endoscopy. Again, I would like to emphasise how important it is for you to attend your endoscopy so any serious issues can be diagnosed and treated as early as possible. If for whatever reason you cannot attend, please give us as much notice as possible so that the hospital can offer the appointment to someone else. Thank you very much.